Globally, mental health problems are the largest cause of disability. Public health organisations want to find techniques to improve the well-being of the public to prevent mental health problems. One such technique is mindfulness.
Mindfulness is about learning to pay close attention to the present moment with an attitude of curiosity and kindness in a non-judgmental way.
Many workplaces and universities around the world offer mindfulness courses as the go-to universal tool to reduce stress. But does the research evidence support this mindfulness hype? Do some people benefit from mindfulness while others don't? What types of mindfulness training should we offer, and to whom?
To answer these questions, we did a study in which we reviewed and combined the best available evidence on face-to-face mindfulness courses. We invited members of the public, well-being managers, and mindfulness teachers to get involved. They helped us to prioritize the questions, to do the research, and to understand the relevance of the results to society.
The study was conducted in 2 phases. First, the researchers searched for all trials on mindfulness training for mental health promotion in non-clinical settings. They identified 136 trials with almost 12,000 participants from 29 countries. In the second phase, the researchers selected the trials that used the most reliable methods. Then, they invited the authors of those trials to share the actual raw data for each participant. 13 trials were finally included in a large, combined dataset.
The effects of mindfulness training varied a lot between studies. But when we combined the raw data from the most reliable trials, the effects became clearer.
So, what does this tell us? How good is mindfulness? For the average adult in the community, practicing mindfulness appears to be better than taking no action. The effects are small, but they appear to last for over 6 months. The courses that work best are those aimed at people who are most stressed or in stressful situations, like healthcare workers.
The effects do not seem to vary by age, gender, or education level. But the trials we combined did not include people with very little formal education or people over 70 years old, so we don't know if they benefit.
There doesn't seem to be a large difference between a 4-hour or 30-hour mindfulness course, but courses that include an element of physical activity seem to be slightly more beneficial. However, these findings don't extend to mindfulness courses delivered through smartphone applications.
We have followed rigorous methods to obtain these results. But we still need to remember that they are averages of very different settings and people. The effects may vary according to other factors which haven't been looked at yet.
Because of all this, it shouldn't be assumed that mindfulness works for everyone, and that all of the mindfulness courses are beneficial. When compared with other practices used to improve mental health and well-being, such as exercise, mindfulness fared neither better nor worse.
It's best if mindfulness training can be offered along other alternatives that people can choose from.